Barbara, welcome to the World Massage Conference. How are you today?
I'm very good. Thank you, Marla. Welcome to everybody who's listening in.
So, Barbara, I just wanted to start off by saying that we had the first time I actually coordinated with you to get you your information from the conference. I received a really great picture of you with your thumb up. And I remember, do you remember that?
Yes.
Yes. And then, and so I was trying to get your name correct, and I'd asked if your name was Barbara Simon Dahman, and you said, actually my name is Barbara Simon. The Dahman represents the thumbs up photo that I sent you. And I tell that story a lot. It was quite humorous. So I learned a lot from that.
Yeah, it's one thing is the thumb up, and the other thing is to show also that in Dorn Spinal Therapy we use our thumb a lot. So it's two messages in that one photo.
Wonderful. So everyone will always remember. I mean, I will certainly remember you with your thumb up.
Thank you.
Great. So let's begin by, could you tell us what exactly Dorn Spinal Therapy is?
Okay. Dorn Spinal Therapy. It is a very gentle, non-manipulative therapy which has been used in Germany for the last 37 years. It used to be originally an animal treatment, and then someone clever came along and thought, well, if it's good for the animals, then it must be good for humans as well. And it originated in Germany, actually in South Germany, where a lot of so-called healers are based, and it's been very popular in Germany. A lot of therapists have learned it. Therapists of all walks of life, be it osteopaths, be it massage therapists, or craniosacral chiropractors, anyone who deals with people potentially presenting with back problems seem to take on this training because it is easy to learn and so effective. It is a structural alignment technique, so we are working on the bones rather than on the muscles, and it is a hands-on technique. It's nothing airy-fairy fluffing around. It's really hands-on. And as I said before, it's very easy to learn, and it's very simple in its application. Basically, just understanding the principles of it makes it very self-explanatory. And one of the main principles is that what is out must go back in. So, as I said, this is one of the main principles, and the good thing about it is that we don't use any force. So, as I said, it's a non-manipulative, non-cracking, non-violent treatment. So we can go to the next slide and the next question.
Okay. Could you tell us a little bit about the background of Dorn Spinal Therapy?
Okay. As I mentioned before, Dorn Spinal Therapy originated in Germany, and it had been used by someone who was known as a healer, and they actually called him a bone setter. That would be the translation from the German word. And Dieter Dorn, who is a farmer in South Germany, living in a village near where this bone setter was living, he had an accident one day and he hurt his back and couldn't find any relief by any specialist, doctor, or whoever was around. And people had told him about this bone setter in the neighboring village and told him to go and see him because apparently he was really, really good. But Dieter Dorn, being quite conventional, didn't want to know about it and said, no, I'm not going there. What good can he do if the doctor doesn't help me? But eventually, because his pain didn't get any better, he decided, well, I might as well give it a go. And he went to see this bone setter and had an instant relief of his pain. And when he came home, he was so impressed by his experience that he decided he wanted to learn what this bone setter was doing on him so he could maybe help other people. So he went back to the bone setter and he just said to him, look, I want to learn this. Can you please teach me? And the bone setter said, look, there's nothing you can learn. You just go and do it. And a couple of weeks later, the bone setter died and left Dieter Dorn basically with this mission of going out and